Hey guys, Dr. Nagel here. I'm going to bring you one of my favorite cases of 2021. It's a case with Jim, and Kathy's here to verify some of these incredible healing stories, so the multiple testimonials coming from Jim in regards to early dementia. And so I'll let them tell that story. I mean, this is something that's near and dear to my heart. My grandfather that I had an amazing relationship with as a kid, had dementia and Alzheimer's, and I watched him just slip away to the point where he really didn't even know me, and there was really nothing that I could do about it because I was an expert in food at that time. This is quite a while ago. Really didn't have the tools to help with dementia and Alzheimer's like hyperbaric and heavy metal detox. So, I really wanted to bring this story. Most people don't realize that there are things that you can do to help. And we're not treating dementia, we're not treating Alzheimer's, we just understand the physiology and have some therapies that help, reverse that physiology. So this is Jim. He came to us, trouble putting thoughts together, had tremors, trouble, couldn't remember what he was reading, losing his train of thought. So what were some of the symptoms that you had? I know I just covered some of them, but so when you first came, I remember you saying that you really didn't have any interest in reading anymore, right?
That's correct. Yeah, and short-term memory loss. I mean, I could be given a number, and I'd almost immediately forget it.
Yeah.
And now I notice that I'm able to retain that. So.
Yeah, and I can tell you just from interacting, so he was in for back issues too, hyperbaric 3, still doing hyperbaric, and then we're on the 6th month of heavy metal detox, so on his, or maybe 5th month. So really just on 2.5 months, at the 2.5 month mark for brain detox, where we actually cross the blood-brain barrier and get the heavy metals out of the brain. And I'm just seeing remarkable changes just with interaction, your ability to maintain your train of thought. You did some public speaking and were able to, was it the Big Brothers, Big Sisters? Is that right? Or
church breakfast.
Oh, church breakfast. You were able to, you did some public speaking. I remember you telling me without being, maintaining your train of thought.
Sure, yeah. It was kind of an off the cuff discussion, and it went pretty well.
Went pretty well.
Yes.
And then you had tremors before.
Yeah, yes, I did.
Yeah. And that's something you said, Kathy. You noticed that.
Yes, I noticed a big difference there because his hands shook all the time, and I thought it was severe. But he's calm.
Yeah.
Still.
Yeah. Even in front of the camera. I mean, that can ramp up the nerves a little bit.
Yeah.
So some of the things that you notice as a wife, sometimes I think as the spouse, you almost notice more. That's why I always ask you how things were going. So what were some of the changes that you've noticed?
Well, the biggest thing was I didn't notice. It happened so slowly, gradually, him going downhill, that I didn't really realize how bad he was until he started to get better.
Yeah.
And he started to get better, and his ideas were popping again. Before, he would just have this blank stare and say, "I don't know." But he has a lot of ideas on what to do on projects, and jumps in and helps now, and is a lot more responsive than he was before.
Yeah, and then I remember you said you're getting some comments from other people about they seem like things are changing. Haven't you? I remember you said somebody, was it an iridologist said that she could.
Oh yeah. This lady's into the natural health, and I said, "Hey, have you noticed any differences in me in the past few months or so?" Because she was aware that I was doing the detox, and she knows about that sort of thing. And she said, "Well, I noticed that your eyes are just so much brighter."
Yeah.
And her impression was that since that's the only organ you can really see to make an evaluation, that it was significant.
Yeah, we can't get in there and see the brain. I mean, we've just seen a remarkable change, and we're talking about heavy metal detox. So that's when mercury especially gets in there and disrupts brain function. but you've also done 30 hours of hyperbaric oxygen therapy, right? Or 30, is that where we're
Close.
at? Somewhere around 30 hours. And, you know, with that pressurized oxygen actually pushes into the plasma, and it can push past those damaged areas, and it's kind of a backdoor approach for healing. The oxygen heals. So, you know, just, I mean, the progress has been amazing, and I appreciate you guys taking the time to let people know that they're, you know, where my grandpa, I really didn't have any tools, you know, that was 15 years ago. Now we have tools. So,
Well, we thank you, Dr. Nagel.
Yeah.
you're welcome.
Dr. Snagles.
Yeah.
We
I
really
appreciate your
appreciate-
practice, because
Yes,
we've both experienced different facets of it, and
Yeah.
they've all been beneficial.
yes.
Yeah, and then
Absolutely.
maybe someday we'll interview you on your journey.
That'd be great.
Okay. All right. Take care.